All right, this answers the question that was asked about how to treat a patient with a penicillin allergy safely. So as usual, we're going to start sort of with having written everything down that comes to mind, or you can build a structure spontaneously. In this case, I'm going to make every attempt to be much less self-indulgent and simply get this under, hopefully, 6 to 7 minutes, maybe 5 if I'm lucky. All right, so we're going to build ourselves our structure. All right, the first question we have to ask is, how can I safely treat a patient with a penicillin allergy? Well, let's think about what we can do over here. If we want to break this down to a structure that can easily be remembered, there's our first layer of structure is going to be 3 things. The first is that, well, can I treat now? Can I treat later? You could do either one of those. And can I use another antibiotic? Okay, so we can use another antibiotic. We can treat now, and we can treat later. I'd just like to say that treating later, depending upon your time frame, is actually a very viable option that most people don't consider. And in order to do that, depending on the availability of the test, we look for whether or not the test, the allergic panel or the allergy panel for penicillin is available, and indeed it is. All right, let's go to our second layer of structure. And we have a couple options over here. All right, if we're going to treat now, we can use a cephalosporin, which of course is going to be part of the treat now structure. We can use we can actually do some sort of provocative testing. We can also give penicillin if you really want. There's about a 10% risk of people that say they're allergic to penicillin, only about 10% are allergic to them. All right, let's build our third layer. If we're looking at the second layer over here and we want to drill ourselves down, question is, what kind of cephalosporins are there? Well, there's actually 4 generations, but for this point we're going to go first generation, a second generation, and a third generation. The advantage of that is that there's actually very little cross-reactivity between this. The numbers run about, numbers actually run about anywhere from 2 to 3%. And as you go from a first generation to a third generation, there is significantly decreased risk. So keep that in mind. So when people say that they're concerned about giving ceftriaxone in a patient that has a penicillin allergy, you're looking at about 2 to 3% risk. And I suppose if you really wanted to qualify it, it'd actually be 0.2%. But the studies have shown 2% to 3% risk. So this is always a viable option, especially if when you ask what kind of allergy they have, it turns out they actually really weren't allergic, it just upset their stomach, etc., etc., etc. All right, there's 2 types of provocative testing that we could use. The first type would be a skin testing, which is just like placing a PPD. And the second would be an orally graded test. And we're going to go with the skin test is more important for a couple reasons, but the first thing we're going to do is actually go with an oral graded test first. And if you are going to do an oral graded test, it's relatively straightforward. What you do is give about 1/10. So in this case, what you do is, in an orally graded test, you take a small dose, about 10% of the original dose, and you just give it to them orally. In about 10 to 15 minutes, you actually increase it to 20. And then over the course of usually an hour and a half to 2 hours, you keep on increasing it until you've actually had about 100% of the dose. And then during this period of time, you monitor them for signs of, obviously, an allergic reaction. All right. Now, the one thing you do need to do with this, and actually it works quite well, the problem with it is it's rather time-consuming. And in addition to it being time-consuming, you do need to have our little friend epinephrine ready. So it doesn't happen often, right? And it's simply given sub-Q. But if you are going to use an oral graded test, you do need to have an EpiPen ready. And I would just only suggest with that you actually have the EpiPen out of the crash cart and ready, because you'd be surprised how when you really desperately need an EpiPen, you can't find one in the crash cart. Now, in a skin test, it's just like placing a PPD. You're going to have your syringe over here, and you're going to inject a small, maybe 1 milliliter of inoculum just under the skin. And you're going to look for a reaction. So we'll start off a little red and then get bigger and get bigger. Anything that looks like a reaction over here that's of any significant size, you should assume that the patient is allergic to penicillin. You can actually use this skin test on multiple things. You can use it on multiple antibiotics, but it's particularly helpful for penicillin. It looks like this. So it's just like a tuberculin, you're just testing for TB, like a Mantoux test. You're taking this, injecting a small amount under the skin, and then waiting for any sort of increase in redness around the area around the skin. If it's positive, then obviously no penicillin for them. If it's negative and you have no other choices, then at that point in time, if it's a negative test, you can give them penicillin. So the big advantage of a skin test is that there's no risk of systemic allergic reaction, and it can be done immediately. The downside of a skin test, it is somewhat technique dependent, but you're all really doing is just placing a wheel the same way you would with lidocaine. So we now come to the star of the show. In fact, we're going to give it its own little color because it's that important. That is we can actually order a blood test to see whether or not a patient is allergic to penicillin. Now, obviously, the advantage is it's a lab test, and it's wildly sensitive and wildly specific. The disadvantage is there's a delay. But this is so important, I'm going to give it actually its own little spot, and we're briefly going to go over it, then we're going to stop this video. So this lab test over here, it's available at Christie. We can actually order it, and it is probably the most underutilized and the most value-added lab test you can order for somebody that has a penicillin allergy or claims to have a penicillin allergy. This test is great for patients, amazingly great for patients. It's great for providers, and it's great for payers. And we'll briefly go over this because we want to finish this in under 9 minutes. So here how you have helped the patients. Right. First off is that you have opened up 2 classes of antibiotics that they couldn't have used before, and that would be penicillins and cephalosporins. And keep in mind that that's important. You have also, by doing so, you've actually opened up the possibility of giving antibiotics with a lower risk profile. And the reason for that, or actually excluding antibiotics with a higher risk profile, the reason for that is, in general, cephalosporins and penicillins, except for the risk of an allergic reaction, are actually pretty benign drugs. Certainly there's less risk of things like interstitial nephritis, and all sorts of other bizarre things that you really want to avoid. So when this test comes back negative, keep in mind that you have improved the ease and effectiveness of care in the future, and you are helping fellow providers out. I just want you to consider this thought experiment. Right? How many times have you seen a patient that has a listed allergy to penicillin, and it made your life difficult? It was no fun. We know it's happened frequently. You think about the fact that only 10% of those people are truly allergic to penicillin, and if the person before you had simply ordered this test and it came back with a big old negative, someone, actually we could have, or somebody else, the primary could have, simply removed the penicillin allergy, and think about how much easier your life would have been rather than dealing with that penicillin allergy that didn't exist. Finally, it's good for payers and the insurance companies. Yes, there's a cost to the initial test, but you think about how much money they're going to save in regards to time, in regards to less expensive and more effective antibiotics, if we know that we can eliminate 90% of those people that say they're allergic to penicillin truly are not allergic to penicillin. So all in all, this is the most underutilized test pretty much in any patient that has a penicillin allergy. You should just order this without any hesitation, and if it's negative, and they're truly not allergic to penicillin, We're going to talk about removing that penicillin allergy, and you have done your paisanas a favor, you've done the payers a favor, and most importantly, you've done your patients an incredible service. Thank you for watching this video. If you have any questions, I'll be happy to answer them.